Welcome to our practice test pharmacology 15. We're going to talk about high yield medication, immunological drugs that are difficult to understand, but I'm going to make them easy for you, memorable with 15 English practice questions with what detailed explanation that you will never forget them. It become memorable. Stick around. Let me make this portion of the pharmacology so easy with 15 questions. First question, a client is prescribed what? Prednisone for what? Autoimmune disorder. Which statement indicate correct understanding? I should stop taking the drug if I feel better. I need to take this with food or milk. I can receive a live vaccine while taking prednisone. I should expect my potassium level to go up. Stop the video. Put down your answer. I know you know it. Let me know what you think. First question, what do you think? The keyword, go for the buzzword. The buzzword is what? Patient is on prednisone. It's an autoimmune disease medication. I've given you a clue. It's immunosuppressant. An immunosuppressant, what do you think the patient is saying the right thing? I've underlined 3 keywords. This is English practice question, test taking strategy. 3 words alone I'm dealing with. I'm dealing with what? Prednisone and autoimmune. And correct understanding. Therefore, I have to look at the answer choice and say, are they saying something right? Stopping the medication when I feel better. I take it with food or some milk. I have to take live vaccine. It's going to what? Increase my potassium. Test taking strategy. Steroid or autoimmune diseases medication should never be stopped abruptly. Number 1 is wrong. Take it with food or milk. I don't know, but I will leave it and see if there's any other choice that may be worse than what I'm hearing. Autoimmune medication, you should avoid live vaccine. That one is gone. You know, steroid is going to what? Increase your sodium. Steroid increases your sodium. That is why your blood pressure is high. Therefore, anything that increases your sodium automatically is going to decrease your potassium. There's a pharmacological thinking associated with it related to pharmacokinetics. I'm not going to go into details. The idea is any medication that increases your sodium, that's the buzzword, is going to decrease your potassium. Therefore, I know this is wrong. It's related to angiotensin system, but don't worry about it. Therefore, test taking strategy. I know number 2 has to be right. But I have no clue whether I need to take it with food or milk. There's a reason why. Steroid will cause what? Ulceration. Therefore, you need to protect your GI tract. That's the reason why. And this is the way I'm going to break down each answer choice, and I'm going to give you keywords that you have to be able to remember them. So, steroid should always be taken with food or milk to protect the GI tract. It causes hypokalemia, hypoglycemia, infection risks, and you should not take any live vaccine. That's number 1. Second question, which finding is most concerning? Prioritization. That means all the 4 are bad, but there's one that is going to kill the patient. That's all. That's what I'm dealing with. Therefore, I'm going to underline my buzzword, and I said, I'm worried about most. I know they are all concerning. All these are concerning, but which one is number 1? What is the problem? A transplant patient, immunocompromised. That's why they are immunological medication. And it's what? Cyclosporine. I've given you the clue. Even if you don't know what cyclosporine is, I've told you that it's a transplant patient. It has to be immune medication. If this were isolated, it's not a video about immune drugs, immune pharmacology, something should ring in your ear and say, cyclosporine paired with transplant means it's an immune suppressive medication. Therefore, I'm worried about something that is going to kill the patient. I see gingival hyperplasia. I don't know. I see hirsutism. I have no clue. I see temperature 101.5. I say, oh, that's not good. I see tremor. Fine. But which one is the bad one? Every time you see a transplant patient, immune medication somebody is taking, and you hear about fever, you know something is not going right. Sepsis is the biggest thing we worry about this medication. They're going to have signs and symptoms associated with the medication. Gingival hyperplasia is common with what? Cyclosporine. What is your treatment? Know this. You should be able to make videos about gingival hyperplasia in my questions and answers. And I talk about gingival hyperplasia. If you don't know the content, all they need to do is good hygiene, see a dentist, and then some antibiotic. It's not going to cure them. The citizen is related to the medication. Tremor, well, if I'm tremor, I'm not saying they're having seizures. Don't let that trap you. If I want you to worry about seizure, I will put it there. Infection is always a bad thing regarding immunosuppression. And never forget about it. Infection is the most dangerous complication about immunosuppressant like cyclosporine. Therefore, that's what I'm picking. Number 3. So what is the mnemonic? To be able to recognize cyclosporine, I want you to take your pen and paper. If you don't know this medication, use this. Any question they're going to ask you will be related to this mnemonic. It calls cyclosporine. C, be caution about infection. Y, Yankee jumps, which is what? Gingival hyperplasia. And then it can affect your creatinine, right? It can also affect your liver, that is the L, and O, other hair growth, that is what? Hirsutism. You see, cyclo associated with cyclosporine, and that is the buzzword, that is the mnemonic. Write it down. If you're in nursing school preparing for your NCLEX or you're already ready to take the NCLEX, this is the keyword. Every time you see cyclosporine, the key information is related to the cyclo. Number 3, and as is teaching a client on long-term steroid, I'm trying to take you up and down, things we've talked about, but then I expand it. Now select and apply long-term corticosteroid therapy. I've already given you the content. You should be able to answer this question. This is the same thing we saw in question 1. Which should be included in the teaching? The nurse is teaching the patient about corticosteroid. Which one should be included in the teaching? Monitor the what? Blood glucose, avoid crowds and sick people, stop the medication immediately if Cushing symptoms occur, take medication in the morning, expect delay in wound healing, report the black tarry stool. I've told you, you know the answer. I know you got it. Question 1, answer this question completely. What do you think? Stop the video, put down your answer. But the key is select or apply in long-term corticosteroid. Select or apply. You don't need to pick all the 6 answers. Pick those that you are 100% confident. If you want to guess, be my guest. But I don't want you to guess because you don't know 100%. You're not going to lose the point if you get only 3. Therefore, if there's 3 answer choice there and you pick 3, you're good. I said, take steroid with milk or fluid because it affects your GI tract. Therefore, if I see a report black tarry stool, hey, you bleeding from ulceration. It's immunosuppressant. Immunosuppressant will affect wound healing. You take the medication in the morning. Even if you don't know, I'm going to leave it there for you. I'll come back. Stop the medication immediately. The word immediately changes everything. There is no immunosuppression. You should stop taking right away. If you develop Cushing symptoms, you should not stop it right away. Slowly, it has to be tapered, right? Avoid what? Crowds and sick people is good because you don't want to get infected. Monitor blood glucose level. It causes hyperglycemia. Why do you have to take it in the morning? Your body, when we wake up in the morning, our steroid goes up like that. Then it stays the same. In the evening, then it comes down. So at night, our steroid is low. In the morning, it's high. Therefore, if you're taking steroid, you should mimic your body steroid production. You make more steroid in the morning. So you should take it in the morning so that your adrenal gland knows that you have steroid in place. So that's why this is the right answer. So what is the key concept I want you to know for each question? Corticosteroid suppresses your immune system, infection, raises glucose, hyperglycemia. It causes ulcer. You're going to have black tarry stool. You should take it with milk or fluid, and you should be tapered slowly. These are concepts you should know. Therefore, glucose monitoring, avoiding seeing contact, taking the medication in the morning, expecting delay in a wound healing, and report black tarries too. These are concepts. I want you to put it down in your note. So this is question 4. Which teaching should the nurse include? For a client taking cyclosporine, this is a selector that apply. We already talked about it, but I want to expand and give you more information. We already know the mnemonic associated with this medication. Monitor blood pressure. Should you do that? Report signs of infection. Avoid grapefruit juice. Monitor kidney and liver labs. And what? Discontinuous if gum bleed. Take with St. John's wort. I've given you the mnemonic associated with the cyclosporine. And we talk about what? Cyclo. With the C, talking about caution about infection. I see infection there. I'm taking it. Why is the yonky gum? I'm seeing gum bleed, but it said discontinuous. You should not. It's expected finding. I see C is what? Is going to affect your creatinine, kidney function. You see, checking your lab for your kidney. And I see L is also your liver lab. I'm going to take care of it. And the O is citizen. But I had extra information for you to think critically. This is NCLEX practice question test taking strategy, giving you critical thinking information. Look at it. Monitor your blood pressure. If your kidney is in trouble, then we should monitor your blood pressure. Say grapefruit juice, it affects the liver in terms of metabolism of the medication. Therefore, it increases cyclosporine. St. John's wort also affect metabolism of the medication. It make it less effective. Therefore, these are little things additional. I've given you all the content regarding cyclosporine. And therefore, what do I say? Grapefruit juice increases drug level. Nephro and hepatic toxicity must be monitored associated with this medication. Therefore, what do you think? Blood pressure monitoring should be ensured. We should report infection. Avoid grapefruit juice. Monitor kidney and liver labs, and take it with St. John's wort. You should not take it with St. John's wort. Therefore, the right answer is what? Monitor the blood pressure, report signs of infection, avoid grapefruit juice, and monitor lab. You should not discontinue it. You should not take it with St. John's wort. These are concepts I want you to be aware of, and that's what shows up in the NCLEX. A client taking Tacrolimus, developed lab work, WBC 2000. What is priority? I don't know what this medication is, Tacrolimus. You don't have to worry about it. But for this video, I want you to know it's immunosuppressant. If it's immunosuppressant, it's making your white WBC 2000. That is too low. That is neutropenic. It's so low, your risk of infection is so increased. What do you want to do? Hold your drug and notify the provider. Encourage fluid intake, give it with food, continues as prescribed. This patient is sick with very neutropenic situation. You should let the doctor know. So the WBC less than 4,000, severe infection, drug should be held. Why did I give you this simple question? Because that's what the NCLEX will ask you. They may not check the question the same way. They may imply that Tacrolimus, you should worry about infection, which was the first thing I said when we start the video. This is another way telling you infection is bad. So number 1 is your right answer. This medication is to re-emphasize cyclosporine, tacrolimus, nephrotoxic, the immunosuppression, it causes infection. The client is prescribed what? Filgrastim after what? Chemotherapy. What is therapeutic effect? These are medications, like I told you, immune medication. They are straightforward if you know how to approach them, if you recognize them. Filgrastim, whenever you hear it, think about something related to your immune system. Think about something related to your immune system, but specifically your WBC. It increases WBC. We increase your WBC when your WBC is low. And what medication we give it to you? Filgrastim. Therefore, this medication is what is responsible for. The easy way to remember this is this mnemonic. Okay, Philly is what? Neutrophils. The Philly is neutrophils. Filgrastim is going to increase your neutrophil. That's the mnemonic. NS is preparing to give Infliximab. It's also an immunosuppressant. What are you going to do first? There is specific information about this medication. You don't have to memorize it. I want you to know it every time you see Infliximab or Adalimumab, these MABs. Before we give it to you, there's one thing we do, not your glucose, not your CBC, not your potassium. What do we check? It's going to activate TB. It's going to activate hepatitis B status. And therefore, what are we going to check? We got to place this and make sure you don't have previous hepatitis B. Or if you have TB, what does that mean? If you've been exposed with the PPD, if you have PPD positivity and you're taking this medication, you're going to get full-blown tuberculosis. NF blockers, which are Infliximab and Adalimumab, will reactivate latent TB or hepatitis B infection. Therefore, we screen them to prevent you from getting active full-blown B infection or tuberculosis. Therefore, B is the right answer. This is question hint. What is your score so far? I know you're doing good. I know you get 7 out of 7, but this medication, I want you to know it from top to the bottom. From the top to the bottom. A nurse care for a female client with psoriasis prescribed Methotrexate for the first time. Which of the following teachings should the nurse include in discharge? This medication, you have to know it. The key word in the question is what? Even if you don't know anything about it. I told you the patient is on what? Patient has what? Psoriasis. Prescribed Methotrexate. This should tell you this is immunosuppression. And therefore, what teaching should you include? Teaching about immunosuppression. This said use 2 forms of contraception to avoid pregnancy. Report mouth sore and bleeding gum. Your liver is going to get injured, and so we should get your liver enzyme. You should take some folic acid with it. You should get nasal flu vaccine. You should stop the medication you have nausea, and you should see ophthalmologist. Something should be ringing in your ear. Immunosuppression. What do you think? Put down your answer in the question and let me know. But I know you got it. I know you get this. Let's break this question down. Look at each answer choice. Select that apply. Don't pick everything. You watch Adapt and class. You know how to approach this question. Stop drug if nausea develop, and immunosuppression should not be stopped. Therefore, this you know is wrong. It's an immunosuppression. Why would you get nasal flu? Nasal flu vaccine is what? Live vaccine. This is gone, right? Take folic acid supplement. What do you think? These will counteract the side effect of what? Methotrexate. It affects your liver, and therefore we should monitor your liver enzyme. Immunosuppression is going to give you a bleeding gum and a mouth sore, gingival hyperplasia in addition to immunosuppression. Let me know about it. It's a teratogenic. Therefore, I don't want you to get pregnant. That's why you have 2 forms of contraception, a barrier method and an oral medication. And number 7 is the trap. They're going to trap you with what? Hydroxychloroquine. You don't need to see ophthalmology because it does not affect your eye. It's hydroxychloroquine that affects your eye. So what is the concept? It's teratogenic. Watch about getting pregnant. Hepatotoxic. Check your lab work. Bone marrow suppression. You're going to have mouth sore and bleeding gum. Folate is going to help reduce the side effect. Therefore, pregnancy, right? We're going to check your enzymes. We're going to report sore. Take folic acid to avoid the side effect. But you should never, take nasal flu vaccine. You should not stop it if you're having nausea and you don't need to see ophthalmologist. Which of the following should the nurse include? Another select apply. A nurse is providing teaching to a parent of a child prescribed epinephrine auto-injector. This should tell you epinephrine auto-injector has to be given IM. It's an IM medication. Do you inject in the mid-outer time? Can you inject it through your clothes? Should you massage the site after injection? Should you call 911 after injection? Should you store it in the refrigerator? Should you use it for mild allergic rhinitis? Break the question down. A bunch of information. Teaching is number one. Prescribe what? Epinephrine. Something should be ringing in your ear that epinephrine is always used for what? Emergency. Therefore, why would you pick number 6? Tell me why you want to pick number 6. It's a mild allergic rhinitis. It's a trap. Epi is emergency. This is not emergency. How can you store this in a refrigerator? Think about it. Test-taking strategy. If you're working with it, most of the time, emergency medication is with you. The kid has it. You're working with it. And in terms of emergency, mommy take it out of the bag and then inject it. Or if the child is old enough, can inject them themselves. You cannot store this in a refrigerator. You can't carry a refrigerator with you. Some of these answer choices, you should be able to think about it. Say, an epi, which is an emergency medication, is an auto-injector. Basically, the patient is going to carry it. How can they refrigerate something like that? Negative. Why do you have to call 911? It's emergency. Do you want to massage a site for after IM injection? These are fundamentals you bring into this question. Oncology medication, the immunological medication. Therefore, I'm not doing that. It's an emergency. The needle can go through your cloth. It's acceptable. And you inject it in the outer aspect of the thigh because that's where you absorb it faster. But it's an IM medication. These concepts I want you to know. Usually for anaphylaxis, never refrigerate it. Store at room temperature. That's the key. Therefore, you can inject it through your clothes. You can call 911. You can inject it in the outer thigh. Never massage the site after injection. You should never store it in the refrigerator. You store it in a room temperature, and you don't use it for mild allergic rhinitis. NSK for a client with what? Psoriasis, prescribe what? Hydroxychloroquine for the first time. This is what I was talking about. This is the content. They will confuse you with what? Methotrexate. And what did I say they're going to confuse you about? Is right there. Which statement indicate correct understanding? I should have regular eye exams. This drug work immediately. It increases my risk of TB. I can stop if I feel better. Immunosuppression, the theme we've been talking about so far, immunosuppression, infection, and don't stop it. Therefore, number 4 is wrong. It does not increase TB. The one that we talk about is Adalimumab and Infliximab. Those are the two, the MABs. This is not the MAB. Immunosuppression does not work right away. It takes some time. Therefore, hydroxychloroquine, never forget, you need to see ophthalmology because it can cause retinal problem. Therefore, number 1 is the right answer. Number 11, 5 more. I know you're going to get these 5 right. Let me know. What is your score? Type it. Tell me I'm ready. Biological medication with this video. A client on what? Adalimumab report fever, chills, cough. What should the next do? What has been the theme so far? I'm telling you, immunological medication, there is certain questions you should expect. Immunological medication, document and recheck 1 hour. Tell the client this is expected, hold the dose and notify the provider, administer another dose. We've been talking about infection and don't stop the medication. It takes time to work. Therefore, what do you want to do? Let me know. Immunosuppressant, infection risk is life-threatening. I should let the doctor know before the patient dies. And nurse is caring for a client on what? Azathioprine, another immunosuppression medication, which lab value require priority monitoring in this client. You have to pay attention to that. This is very, very important. It requires a lot of thinking, but it's straightforward. You got it. If you've never seen it before, azathioprine. It's an immunosuppressant. It causes bone marrow suppression. It's going to decrease your WBC. It's going to decrease your platelet. It's going to decrease your white count. But the most important, as I've been talking about all along with immunosuppression, is what? WBC. It's more important than any of them. WBC is the most important. So watch for it. A client with chronic kidney disease is prescribed Epoetin. Epoetin is one of those medications you have to know in chemotherapy and immune system medication. We give it to patients to do what? Increase their WBC, increase their hemoglobin, increase their platelet, or their potassium? Who do we give it to? The question says, which lab value indicate Epoetin is effective? We saw a question about what we use for when we need to increase your WBC, which is what? The Filgrastim. The platelet is called Opraverkin. You know, we don't use this medication to increase the potassium. Therefore, it has to be hemoglobin. Epoetin increases your hemoglobin. Therefore, it stimulates RBC production. And that is the right answer. A client with what? Autoimmune disease is receiving immunoglobulin. Immunoglobulin are very powerful immune medication, right? They are infusions we give it to patients for specific reason. If you have severe infection, you have antibodies floating, we can use this immunoglobulin to help with that. But the major side effect is no mild fever and chills. It's no headache during infusion. It's no fatigue the next day. It's allergic reaction. Immune medications, especially medication for antibodies, they are immunoglobulins. The major side effect is what? Allergic reaction. Therefore, chest tightness and wheezing are number one. And the last question. This is just to tie everything up. This is just to make everything perfect. And this is scheduled for MMR vaccine, which condition require postponing. This is just everything together. You know that immune medication, patients who is taking that medication, they have to be careful. They are immunocompromised. They should avoid live vaccine. What is the problem? MMR is a live vaccine. Therefore, which condition will make you pause and stop the medication? Is it cold? Is it fever 99.2? Or they be on steroid for a long time? Or they have otitis media? What do you think? What do you think? IV otitis media, it's just basically you have a ear infection. You still can get your vaccination. You get cold symptoms, you can still get it. Your temperature 99.2, you can still get it. But if you're immunocompromised because you're on long-term prednisone, you should not get it. Live vaccine is bad. 15 questions. NCLEX practice question. Test-taking strategy with rationale, using critical thinking, immune, drugs, medication, pharmacology to help you master. Thank you for following the series. If you like, you can watch all the videos associated with these medications. If you're having problem with pharmacology, this series is for you. Good luck in your exams and nursing school. Take care. Bye.